Hey guys, and welcome to How to Gastro. So in today's video, we'll be exploring what is an ESR or erythrocyte sedimentation rate blood test. So let's get started. So before we get into the specifics of the ESR blood test itself, let's talk a little bit about what you can expect when your doctor orders an ESR blood test for you. So an ESR blood test is a straightforward and uncomplicated test. You will not be required to fast or make any special preparations before going in for an ESR test. An ESR test is done with the taking of a simple blood sample. So here, a needle is used to draw blood from a vein in your arm into an EDTA or purple top blood tube. The collected blood is then sent to a laboratory where it is analyzed and resulted. So as we can see in this little image below, we can see the purple top or EDTA blood tube, and we see this phlebotomist here is taking the sample of the blood through venipuncture or puncture in the vein of the patient's arm. So what is an ESR blood test? So an ESR or erythrocyte sedimentation rate blood test is a simple, non-specific test that measures how quickly red blood cells, which are also known as erythrocytes, settle at the bottom of a test tube containing a blood sample over a specific period, which is usually 1 hour. So although that sounds like a mouthful, it's actually pretty simple. So as we saw in the previous slide, the phleb will draw the blood sample into the blood tube. And in the ESR blood test, what actually happens is the test will measure how fast all the red blood cells form to the bottom of a tube. And this is done worldwide over the period of 60 minutes. And why is this clinically important, or why is this actually useful to us? So inflammation causes the red blood cells to stick together and sink faster. So whenever there's some sort of inflammation in the body, it will actually cause these red blood cells to fall down faster and clump together pretty quickly, meaning that we will have a high ESR or more inflammation in the body. So let's explore this a bit further in the next slide. So the ESR test is often used to detect inflammation in the body. It is a non-specific test, meaning it doesn't point to a specific cause of inflammation, but can indicate the presence of an inflammatory condition, such as an infection in the body, or an autoimmune disease like rheumatoid arthritis or lupus, and even some types of cancer. So inflammation in the body causes the red blood cells to clump together faster, making them settle faster. This means the faster the red blood cells form, the higher the ESR value, indicating more inflammation in the body. So let's look at this image on the left of the screen. So we have our blood sample, which is left to sit for the period of an hour, and this distance here in millimeters, which actually indicates how far the red blood cells have fallen, indicate the ESR value or the erythrocyte sedimentation rate value. So it's actually measured in millimeters per hour because this is an actual millimeter value. And here in the test tube, we can see the white blood cells and platelets, and then the red blood cells that have all fallen to the bottom of our sample over the span of an hour. So the distance in millimeters the red blood cells have fallen in the hour is actually the ESR or erythrocyte sedimentation rate. So as we mentioned in the previous slide and in this slide, why is this actually useful? So the ESR blood test can reveal inflammation that may be caused by an infection and some autoimmune diseases that is occurring in the body. So remember, the higher the ESR, which means the greater the ESR, it indicates more inflammation in the body. So now let's explore the normal ranges or the normal values of the ESR in healthy adults. So the normal range of the ESR or erythrocyte sedimentation rate can vary depending on factors such as age and sex. However, here are the normal ranges in healthy individuals. So in men under the age of 50, we have 0 to 15 millimeters per hour. In men over 50, we have 0 to 20 millimeters per hour. Women under the age of 50, we have 0 to 20 millimeters per hour. And over the age of 50, we have 0 to 30 millimeters per hour. In children, it's typically around 0 to 10 millimeters per hour. And in newborns, it's about 0 to 2 millimeters per hour. So these are the usual normal ranges. Anything above these ranges will suggest inflammation, infection, chronic inflammatory disease, or even cancer. So there are also a few factors that can affect the ESR. So the ESR tends to increase with age. Women also have slightly higher ESR values than men, particularly during menstruation and pregnancy. So ESR levels can also be elevated during pregnancy. Individuals with anemia will have elevated ESR levels because if there's fewer red blood cells, of course, they're going to fall quicker, which means that the ESR value will automatically be higher. And there's also certain medications, such as birth control pills, vitamin A supplements, cortisone, methyl dopa, quinine, and theophylline, which can affect the ESR levels as well. So the clinical relevance of interpreting the ESR results. So I do apologize for any interruptions in the audio. There's a crazy windstorm going on outside, so I'm not sure how much of it is actually being recorded on the audio. So a high ESR test result may be from a condition that causes inflammation, such as systemic and localized inflammatory and infectious disease, as we spoke about in the previous slides, anemia, arthritis, which is the inflammation of the arteries in the body, arthritis, which is the inflammation of the joint spaces, systemic vasculitis, inflammatory bowel disease, which is also a chronic inflammatory process, kidney disease, TB, rheumatoid arthritis, and other autoimmune diseases like lupus, heart disease, and cancer, including some types of lymphoma and multiple myelomas. So a low ESR test result means that your red blood cells sank more slowly than normal, and this may be caused in conditions such as a blood disorder like polycythemia, where there's an increased amount of red blood cells in the body, meaning that obviously it's going to take longer for more cells to sink to the bottom, so there'll be a low ESR. Also sickle cell disease, this is due to the irregular shape of the red blood cells. Leukocytosis, meaning a very high white blood cell count, congestive heart failure, and certain kidney and liver problems, which actually cause low levels of protein and fibrogen in the blood, will also cause a lower than expected ESR level. So as we have just seen, the ESR test is very important, but it can't diagnose a specific disease, but can be a very useful tool in detecting inflammation within the body. So thank you guys so much for watching. I hope you found this video very interesting and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community. Take care and have a great day further. Bye for now.